everybody, it's Lori White from the Greater Providence Chamber of Commerce, and welcome to another episode of Chamber TV. This is episode number 76, and today we are live on LinkedIn, we are live on Facebook, we are live on Twitter, as well as live on Chamber TV. So we have lots of avenues to get our message out, and we have an important topic to delve into today. And to help us do that, we have Rebecca Weber from the Cambridge Innovation Center Health, a new offspring of CIC. And Rebecca, it is so great to see you again. We saw each other just a couple of weeks ago when you were joining us for Chamber TV to talk about all the good work that CIC has been doing in the community, but now you have a new project to share. So how are you?
Thank you, Lori. Thank you for having me. I'm sorry I haven't seen you in person in the intervening time, but I'm hopeful that this new solution that we're going to discuss today will be part of that equation.
Okay, so a couple of weeks ago, I got an email from you. It was really exciting to say you had been dispatched to a new set of responsibilities within the CIC family. So tell us a little bit about what those new responsibilities are and a little bit about CIC Health.
Happy to. Thank you, Lori. It's true. It's sort of an extension of the idea that we broke news the last time you and I spoke a couple months ago that CIC was entering a new foray of COVID testing. And now I'm here to affirm some of that knowledge and to explain our expanded delivery of this service to individuals, organizations, institutions, companies, and the broader public. And excited to share that our new website, cic-health.com, actually launched today. So we can debut that today as well.
Fantastic. So what is assurance testing in layman's terms?
Assurance testing. So what we are referring to as assurance testing is actually a term that was coined by Dr. Atul Gawande, who is the polymath surgeon and hospital specialist and writer and journalist and innovator who is collaborating with the CEO of CIC, Tim Rowe, among other partners, to deliver a solution that includes regular, frequent, and routine testing for COVID. And that testing comes in the form of the RT-PCR test, Lori, which is a highly sensitive test that requires a swab of just the inside of your nostril, the outside part, not the brain tickling part, and delivers results within, on average, about 24 hours. We recognized, Lori, and I alluded to this in our conversation a couple months ago, that being in the real estate space, we were going to suffer the changes in habits that people were bringing to the workplace. In other words, people have decided to work from home. People have decided to work differently. People have decided to share their space differently. But we're also in the innovation space, Lori. So as a result, our CEO decided that there was a real gap in the market to deliver a comprehensive testing solution. Not just the lab, not just the results, not just the clinician network, but the entire stack of services directly to companies and organizations that want to bring people safely back to pre-pandemic activity. So this began as an experiment in the Cambridge area, and it has since grown into a full-fledged subsidiary of CIC called CIC Health. And yes, I have been reallocated to this subsidiary to lead growth, which is effectively sales and business development.
Okay, so what does that mean to folks that might be listening or watching right now and they have questions about going back to work, or
Sure.
Even if they're working remotely, is there a solution for those people that are working remotely too to be able to access this? So
Absolutely.
Yeah.
Yeah, I think this is new for everybody, right, Lori? Like I didn't know an antigen test from a PCR test before I started with CIC Health about a month ago. This is such undiscovered territory to most of us who read about this in the news. And unfortunately, for those who are suffering from the disease, they've experienced it far too personally. So what we try to do is disambiguate the complexities around the logistics of COVID testing. So you need to have, for example, a lab that will process the results. You need to have the consumables, the supplies that are actually necessary to conduct the test. You need to have a clinician to order the test and to review the results. And in the case that you might test positive, to actually offer you some guidance about next steps. And you need to have an interface that brings all of those things together. So CIC Health decided that we would create this package of services that works in combination with a lab partner. We have started by working with the Broad Institute. which is a collaboration between Harvard and MIT up in Cambridge. But we now have new lab relationships that are helping us drive down the cost of testing and hopefully speed up the return of results in different geographies. We are working with a clinician network that orders our tests and helps process those results. And we are working with a software partner who delivers an email to your inbox, again, within an average of 24 hours from the sample arriving at the lab to deliver your results. So if you work for a company that is interested in conducting testing as one of the many remediations that people are taking to try to protect themselves and to promote well-being, CIC Health has a solution for you. And as for individuals who may just want a one-off test, pretty soon we're going to be offering that service up in Cambridge first, and then more broadly as we continue to perfect the system.
Okay, so right now your target market is employers who want to be able to provide a turnkey solution for their employees and for them, the business itself, to be able to do testing and to do it all in one comprehensive packages. Is that essentially what the product is?
I'm going to reappropriate that as my pitch, Lori. That's exactly it. That is the product. It is one package that delivers your testing results. And again, we advocate for this regular routine testing that can help identify really low levels of the virus and can help mitigate the risk of contagion as a result within your population. So we agree that to test is better to not test at all, but to test routinely is part of your successful strategy to return to pre-pandemic levels of activity. And that's actually not exclusive to employers. I know we're listening, or we've got a large audience of employers here and employees who work for large Rhode Island-based companies. But I think a big part of the equation of getting those employees back to work is making sure that their students or their kids have places to go to school. And so we're actually working with a lot of public, private, charter, and independent schools in Massachusetts and elsewhere to deliver this solution. So we can offer this to schools. We can offer this to not-for-profits. We can offer this to institutions, higher education and otherwise. We've actually already deployed this solution to a very prominent hospital in the Boston area. So we have a solution that is accurate, it is fast, and it is reasonably affordable relative to the other solutions on the market.
Okay, so let's break it down a little bit. So sure. I'm the president of the chamber. I have employees. I'm interested in this because we're all going to return to the office. So tell me step by step of, what, how I might embrace this product and what it costs and how would I, actually get our employees and our team together to take the test. So just
Sure.
break it down in simple terms.
It does take a little legwork on the part of our partners and clients, Lori, for sure, because we need to understand what your needs are. So it obligates people to think deeply about how often they want to test, when they want to test, and a schedule that works for them. There's also got to be someone within your organization who is the main point of contact for the software. Each individual will receive their results, but there is still a company or an entity-based interface that you will have to work with. And we need to work with that individual to order the right number of tests, to make sure that they arrive on the given timeline, and to make sure that the tests are processed accurately. So if you were to submit an inquiry form to our website that's being displayed now, that form would be fielded by a member of our sales team, and that member of the sales team would call you up, Lori, or one of your colleagues, and walk you through exactly what you would need to do in order to facilitate this process. The cost ranges, and the reason it ranges, Lori, is a function of the test that you choose to deploy, the location of the lab that you're choosing, and the timeline or the logistics that are involved in delivering that test. So our hope is ultimately to be able to offer not just one test from one lab, but to identify the test, the price point, and the lab that works best for your organization. And our team will talk you through that process during intake. Once you have that initial conversation, and we've got videos that allow you to go back and refresh your understanding and a team that supports implementation, we then send the consumables, the actual test, to your location. And there needs to be some sort of practitioner who's there to oversee the tests. So that works really well, for example, at a school that may already have a nurse or another credentialed medical professional who's there. We work with a number of ambulatory service providers who can have an EMT on staff or someone else to oversee the conducting of the test. And then you put your Q-tip, effectively, your little swab, back in the tube. It gets carried to our lab, and you get the results on email within about 24 hours.
So so you would arrange for, in this hypothetical example, for a clinician or a surrogate to a clinician to come and oversee and be part of the dispensing of the test, and then the clinician would take the swabs and get it to the courier to get it to the testing facility, and then each person would get his or her own results.
Exactly. There are a lot of moving pieces there, Lori, and that's the complexity that we don't want you as the business leader to worry about. Now, there are actually two different dimensions of what you just described, Lori. For example, an association group like the Chamber could facilitate this for members, or individual member companies could facilitate it for themselves at their specific locations. So we're talking to athletic conferences to think about offering this to their member schools in order to bring NCAA athletes back to campus, as one example of an association that can then be the front door for other prospective users.
So just clarify a little bit about what's the stumbling block, what's the problem to be solved with the present model?
Yeah, it's a great point, Lori, because there's no absence of demand, right? I mean, if I could give you a test today, I don't think that you'd exhibit a lot of hesitation there, right? Better to know and better to test than to not. So I'll tell you a pretty personal story. I have a family member who was contacted by the CDC, and that family member wanted to test readily because they needed to know whether or not the rest of their family needed to quarantine and whether or not they had to stay home as an essential worker. And they contacted a pharmacy, a retail pharmacy, who is conducting a great service of offering testing, and they couldn't get in for several days. And they looked into the test that's at the convention center. And again, a pretty significant waiting period and a longer still waiting period for the results. I was actually able to take that family member at CIC Providence within 15 hours of the phone call to be tested and then get results within about 30 hours of the whole travail. So call around 5 p.m. and results back in the very early hours of Saturday morning. So it was a Thursday night call in very early hours of Saturday morning test results. So we're taking a lot of the waiting out of the experience, Lori. And also, it's one thing to just get a one-off test. It's another thing to stand up this entire stack of services that provide that comprehensive offering to do it on a routinized basis. And that with mask wearing, that with reducing contact, that with reducing physical contact to spaces, we think is part of the equation of returning to pre-pandemic activity.
So the concept is the service comes to the work site, the employer's work site. It's fast, it's private, it's accurate, and
Yes.
you can determine over the course of the engagement with CIC Health how frequently you would like your employee base to be tested. So some employers or some places are testing their employees, very, very regularly, a couple of times a week. So that's an option with your program.
Absolutely. And I think it's interesting too to note, Lori, that there are tests that return results faster. For example, there are rapid antigen tests. Those tests have a different level of sensitivity and a different protocol associated with them. The reason we are working first with PCR tests is because the validation would suggest that they have a higher degree of confidence in picking up smaller amounts of the virus, meaning you pick up an indication of the virus sooner and you're faster to be able to mitigate the risk of contagion. So it's a really important point to note.
Yeah, so the sensitivity of the testing defines the accuracy, and there are a multitude of tests that are out there that deliver any range of specific accuracy sensitivities. But tell us a little bit about what the different types of testing are. You mentioned PCR versus other rapid tests. Give us a little primer on the testing medium, if you will.
You're testing my very limited and rudimentary understanding of biology and chemistry here, Lori, and probably some other subject I should be better versed in. The tests operate in a couple different ways, Lori. Some of them are a function of the process, And some of them are a function of what the tests are looking for. So my oversimplified understanding of the difference, for example, between a PCR and an antigen test is that an antigen test requires your body to have actually had a response to the virus by the time you can actually identify the presence that would yield a positive result. Whereas a PCR test just needs the presence of the virus in very low quantities to yield the result. So that's one of the main differences. There's also a difference in the way—
test is a blood test, right?
Sorry?
The antigen test is a blood test, right?
I think that's an antibody test, which is different further still. It indicates whether or not you have encountered the virus and tries to approximate an understanding of what I think colloquially we call immunity, but I'm not sure it's widely accepted in the scientific text. The antigen test can also be administered with a nasal swab. Okay. So there are the different mechanisms, right? The blood test for antibodies, the nasal swab for the PCR test and the antigen test. And then there are the nasal pharyngeal tests, which go further up. So that's a different process entirely. And that can also be processed as a PCR test. There are also different formats, Lori, for example, of how they're processed, like a pooled test. A pooled test waits until you have a critical mass of samples. Those samples are then all tested concurrently. So it reduces the incremental cost per sample. However, if even one sample within the pool tests positive, then each of those samples need to be tested individually to understand who actually did have the positive result. So that can be slower, even though it is produced at a lower cost. It all depends. And this science is evolving all the time, Lori, and luckily we have some really sophisticated team members who keep a pulse on the newest test type. For example, there are some institutions that are testing wastewater. There are some institutions that are testing surfaces for contact evidence. So there are different ways that we're learning to test for the virus all the time, and they're not necessarily mutually exclusive. So I think the beauty of offering a point of access to the kind of test that's appropriate for your population at a price point that's affordable to you and a routine or a schedule that works for your community is that once again, CIC is bringing a really innovative solution and access to an innovative solution to sometimes small or medium-sized employers who otherwise wouldn't have the scale or the bandwidth to be able to construct this themselves. Large employers might be able to do this, right? They might be able to contract, they might be able to work this out for themselves. But just like CIC proper delivers the infrastructure overhead and takes a lot of the headache out of the office building, we're trying to do the same by extending access to testing. And the more large clients we can get, the more we can exert our leverage in the market to continue to drive the price of each test down so that we can supply more affordable testing to a wider and wider group of clients.
Who would have ever guessed a year ago when we were inaugurating CIC that we would be talking about not just space, but testing for a pandemic? Very
You're right.
Interesting turn of events. Tell us a little bit about the Brood Institute and about the partners that you're working with, because it is a very impressive group.
Thank you. Yeah, the Brood Institute is a really auspicious lab in Cambridge, Lori, and that's logistically a huge advantage to our Rhode Island clients who are just an hour's drive away from depositing those samples, which is really useful to reinforce our average 24-hour turnaround on our results. The Broad Institute uses a system of robots to conduct their testing. And unfortunately, I haven't seen it myself in person, though I have seen the videos, and it's incredibly impressive if anyone wants to Google those. And the robotic automation that is endemic to the Broad Institute's process is part of what makes it so rapid in their own processing. Although I need to be careful, rapid tests are a different category. That's a faster turnaround time and a different kind of test. We just think these are quite fast and quite accurate. There are a number of colleges and universities locally who have already partnered directly with the Broad in order to conduct their own testing. So that speaks also to the confidence that other institutions have in the Broad, not to mention the fact that, again, we had an opportunity to provide large-scale testing to a really prominent hospital in the Boston area, and we did that in concert with the Broad, and will continue to do so. So we feel very strongly about the Broad. Now, the experts at the Broad contributed some of that knowledge or transplanted some of that knowledge to the University of Minnesota Genomics Center, and CIC Health has really intimate access to the lab capacity that's coming online in the greater Minneapolis area, which is important for a bunch of reasons, Lori. As we seek to expand our lab network, we want to be close to large population centers or just people who might be prospective clients for us so that we can maintain that really fast turnaround time for them with the same protocol and the same level of credibility that we have with the Broad.
So who are some of the partners that are associated with the Broad?
Harvard and MIT are the primary partners associated with the Broad. And there are some local colleges and universities that I have read about specifically in the local news that are also using the Broad for their testing.
But Harvard and MIT are among the founding partners.
That's correct.
Yeah.
That's correct.
This whole science and technology of testing and sensitivity and the like just seems to move at the speed of lightning. I imagine we could have this very same conversation, a week from now, and there'd be different modalities that you'd be able to talk about. And because of the affiliation with the Broad and the ability to have the top scientists, some of the top scientists in the nation, being able to really continue to be on top and be at the tip of the spear in terms of COVID-19 testing.
Yeah, we're so fortunate to have the advantage that we do, Lori. A lot of it, I think, comes through CIC's longstanding reputation to foster and encourage innovation. A lot of it does come from our affiliation with Dr. Atul Gawande, who is just visionary with respect to interventions that can support public health. And a lot of it has to do with the fact that we are accustomed to scaling things at speed and scaling logistical processes at speed. And as a result, as we have gained increasing prominence in the testing space in the greater Massachusetts area, we now have individuals who are coming to us suggesting that we could run pilots, suggesting that we could do demonstration programs, suggesting that we could test out some of these new methods concurrent with the PCR testing so that we can continue to do side-by-side comparisons and understand the impact of these tests on the ability for individuals to return to the workplace or other settings.
What specifically can we offer to the members of the Greater Providence Chamber of Commerce in terms of building awareness and
Sure.
Delivering really much needed service?
Part of the excitement, Lori, I've come to understand in my very limited engagement with a startup is that things happen really quickly. So as I mentioned at the top of our conversation, we debuted our website today. So again, I would encourage any members to go to cic-health.com. There is an inquiry form there. And that inquiry form, again, will be fielded by a member of our team who will give you a personalized outreach and talk you through the process. For the members who are interested in wondering about, for example, how it works or the actual price point, that range is between $60 and $90, depending on a number of factors, whether or not it's repeat testing, the number of individuals you will be testing, and how you choose to set up your site. And know that there will be CIC support, CIC health support, I should say, as you implement this solution, because again, it's new for all of us and there are a lot of moving parts and we take anything that influences health and well-being really seriously. So we hope that we're part of the solution of demystifying testing and then introducing testing more broadly as part of the way that people can safely resume the return to pre-pandemic activity.
$60 to $90 per test, is that
per
correct?
test. You got it.
And
Yep, that's exactly right.
What is the current state of insurance reimbursement relative to testing?
We are only offering out of pocket at the moment. There might be a different conversation if you're a large enough insurer who is self-insured, and we can have that conversation or refer you to specialists who can support that conversation. But we are only out of pocket cash pay. With respect to the current state, there is no mandate that requires insurance reimbursement for asymptomatic tests. And this is largely an asymptomatic test. It doesn't mean that we can't test individuals with symptoms. It's just that this test is traditionally considered asymptomatic. In Rhode Island, at least, I should say. There is no mandate.
What are the founders of your organization, what are they forecasting? Dr. Gwande's as an example in terms of
Sure.
Where are we going with all this? And
it's such a great question, Lori. I think in the Immediate term, we are working on building out as many lab partnerships and different testing modalities, to borrow your phrase, as we can, so that we can offer access to the best array of flexible and affordable options, much like our CIC real estate business, for our clients. So we want to become almost like a platform that grants access to people and meets them where they are. In the further near term, Lori, as we think about the fact that we've built out this really sophisticated logistical supply chain, you can create some logical extensions of what else we could hope to deploy in a really sophisticated supply chain, especially if we add a few more features like cold storage, or a few more features like our own team that can collect the samples. So you can think in the coming months, we hope that there are new solutions that will require that sort of logistical supply chain that we could help support. But we know that testing will probably overlap with any other new intervention, whether it be a vaccine or another response to the pandemic for the foreseeable future, because you just can't cover an entire population fast enough that you can do it serially. You have to do them concurrently.
Based on what you're describing, it seems as though this notion of testing is going to be in our future for a very, very, very long time. Is that a good statement?
I think that's what we're hearing from the experts, Lori. And again, I am by no means a scientific expert. I don't think I've had science in the last 17 years, but I can say that that is the conventional wisdom. When you think about what you need to do in order to make people feel more comfortable about re-entry, whether it's a social setting or a workplace setting or an institutional setting, it is figuring out ways to layer protection. And again, we're doing that a lot. We're seeing it everywhere with masks. We're understanding the value of social distancing. We are internalizing the notion of reducing touch points, contact with people and with spaces. And now testing can be one more data point that you have to help support the return to more healthful activity.
If you're just joining us, we are speaking with Rebecca Weber from the newly stood up CIC Health organization. And what Rebecca is talking about is rapid testing on site for employers and their employees, rapid and accurate testing as part of the new CIC set of offerings, suite of offerings. So in addition to co-working space, we're actually doing co-working testing as well. So that's what we're talking about. And Rebecca, any last thoughts that you'd like to share with us? And don't forget to remind folks once again how they can learn more about the website, what the URL is. I think people are interested in learning about the robots that you mentioned and how they might begin the first set of steps to onboard this process if they were interested.
Thank you for the opportunity, Lori. We will bring that fast, affordable, accurate test to be stood up at your workplace. So that's an important note, that we want to meet you where you are with your need, your employer base. And even if you don't know what you need, which I think is most of us in this environment, again, we agree that more testing is better than no testing, and just submit an inquiry form. One member of our team will get back to you. We've been doing this for months now. We've gotten our feet under us. We've done it with more than 100 clients. We've conducted more than 100,000 tests at this point. So have some confidence in our ability to at least share what we have done, and hope to offer you some guidance about what you can do. And for Rhode Islanders, we do have access to testing at the Broad and other labs that are coming online. And it's a wonderful resource to support small, medium, large organizations, institutions, public, private. And again, we're working with hospitals. We're working with really sophisticated organizations. So please visit our website, cic-health.com, and submit an inquiry form if you'd like to learn more. We're very hopeful that we can find a way to support the return to pre-pandemic activity for you and your colleagues in a safe and affordable way.
Thank you for emphasizing that small businesses also would have an opportunity to plug into this. So even, micro-size businesses that would be somewhat typical of a CIC tenant is a solution for them as well, right?
Absolutely. And in fact, our CIC clients do benefit from this service. So it's just another reason to join our community, to be on the cutting edge, to have access to this sort of infrastructure. But we can absolutely talk to any size business about the ability to establish and conduct routine COVID testing.
Thank you, Rebecca Weber from CIC Health, for joining us today on Chamber TV. Again, we were live on Facebook, LinkedIn, Twitter. Also, Chamber TV is available on profchamber.com website. You can see all of the episodes that we've produced over the last several months. This is episode number 76. Rebecca, this is your second time around on Chamber TV, so I am hoping that we can call on you in a couple of weeks to come back and tell us what's new, to tell us what's going on, and to continue to help us all understand and learn about the pandemic in ways that we can all go back to work safely.
I'd be grateful for the chance, Lori. Thank you for allowing me to share this new service, and who knows what we'll announce at that point. The world is changing so quickly.
Yeah. And just as a teaser for folks listening, we will be talking to Dr. Ashish Jha from Brown University School of Public Health, the dean. You may have seen him on many of the networks over the past several months. He's a global pandemic expert. He, again, is new as the Dean of Public Health at Brown University, so he will be joining us on Chamber TV Friday at noon. So we're really excited to be able to speak with him and to hear his perspective on all that's going on in this testing arena and other things that might be topical on that day. So we will see you next time. Thank you, everybody, for tuning in, and have a good day. Bye-bye.